Welcome back to a new video. In this video, I'm going to address the very important and common issue that a lot of people face, especially beyond the age of 50. That is knee arthritis. Some studies have also shown that people in mid-30s and late 30s also experience knee arthritis because of genetics. It may seem like there is no cure for it because it's genetic, but that is what we're going to find out today with the help of Dr. Harsha, who is a renowned and experienced physiotherapist in Hubli. And he has some great tips and advice to share with us as to how physiotherapy can help relieve you of knee arthritis and maybe even permanently make it go away. So if you want a life free of pain and hindrances when you want to move, stretch, walk freely, then this video is for you. Before we dive into the video, I just want to know if the previous video with Dr. Harsha about back pain and sciatica was helpful. If you watched it, then please do leave a comment below to tell me how it was helpful to you. And if you haven't, I'm going to link it right here for you to watch it. Do check it out. Hi Dr. Harsha, welcome to another video of our collaboration. It has been great making these videos with you in collaboration with Sanmati Physiotherapy. Please introduce yourself for the new audience.
I'm Dr. Harsha Yalgi. I'm a consultant physiotherapist, and today our topic is knee arthritis.
Thank you for the introduction. Let's get started. My first question is, what is knee arthritis?
Knee arthritis is nothing but the degenerative change in the knee joint. It is nothing but wear and tear in the knee joint. As you can see, this is the knee model. Yeah. In between these two bones, there is a gap here. This is the femur and this is the tibia. And this gap is worn out with age due to friction. And this is knee arthritis.
All right. Now it's important to understand the symptoms. And that leads me to the second question. What are the symptoms of knee arthritis?
The patient will complain of pain in the knee while sitting down and getting up. The patient complains pain in the knee during walking and climbing the stairs. And there will be swelling in and around knee joint. These are the typical symptoms. This is the typical worn out knee joint, this is a dummy model. So you can see the bone is exposed and the cartilage is worn out and the cushioning also is worn out. So this will be the condition of your knee when you have osteoarthritis knee joint. But again, it depends on the grade. There are different type of grades in this. So this is a typical worn out knee joint, and this is the healthy knee joint. It could be something like this.
Yeah. Oh, wow. So much difference.
Yes.
And
yes.
It's important to understand what is the main issue. Sometimes we get confused between temporary knee pain for maybe arthritis and start to panic. So the third question is how to identify knee arthritis.
A simple X-ray, standing X-ray, which will determine whether the patient is having osteoarthritis. In the X-ray, what typically we can see is the gap between the two bone is reduced. So that is the meaning that the patient is having osteoarthritis knee joint.
Okay, does that mean the larger the gap, the better and more smooth the movement?
Exactly. The larger the gap, the better the knee is.
Okay.
The gap between these two bones, if it is reduced, then the knee arthritis is more. There are some grade in knee arthritis. Like grade 1 is the gap is correct, but there is only a little wear and tear in the knee joint. That is grade 1 arthritis. Grade 2 arthritis is the gap is slightly reduced and the wear and tear is a little more than grade 1. Grade 3 arthritis is in between these two bones, there is a thin line gap remaining, and the wear and tear also is more, and patient will be slightly limping with grade 3 arthritis. And grade 4 arthritis is there is no gap between these two bones. Both the bones are touching with each other. So that is grade 4 arthritis, and typically we see some deformities also associated with grade 4 arthritis. The symptoms is more aggressive in nature. So resting pain also is that in grade 4.
Okay.
Yeah.
Right. By now, our audience must be curious to know about the causes. So the fourth question is, what are the causes of knee arthritis?
Basically, there are 4 to 5 causes why there is arthritis in knee. The first cause is there is a lubrication here. We call it synovial fluid. Okay, so with age, what happens? The synovial fluid comes down, and there will be friction of the knee joint. So there is wear and tear. So the reason number 1 is reduction in the synovial fluid. Okay. Reason number 2 is when these muscles are weak, this bone will not be in its position. The bone will start coming down due to weakness of these muscles, this quadriceps muscles, hamstring muscles, the thigh muscles basically. Yeah. So if they are weak, the femur doesn't stay in its position, it starts coming down. Okay, this is reason number 2. Reason number 3 is the body weight. So if a person is weighing around 50 kg, then each knee will be having 25 kg load. Okay, and if the person is weighing around 80 kg, then each leg will be having around 40 kg load. So more the weight, more the load on the knee joint. The fourth reason is because of the alignment. Okay, typically most of the patient have medial compartment arthritis. That is, the alignment of the knee changes, and the medial compartment is worn out in most of the cases. So it is because of the alignment, because of the pelvis size, there is change in the alignment. Even with the weight, there is change in the alignment. So the fourth reason is because of the alignment. And the fifth reason is age, of course. After 50 years, due to constant wear and tear, because of their profession and other activities, there is wear and tear in the knee. So it is typically 80% of the females in the lifetime experience knee pain, 80% of females, and 60 to 70% of the men experience knee pain, that is wear and tear of the knee. And the last factor is genetic. If your parents have it, it is quite possible that you might also develop a knee pain.
Thankfully, we have people like you to help us with physiotherapy and actually avoid what genetics brings to us. The next question, which is the fifth question, how can physiotherapy help?
Whatever wear and tear has happened in the cushioning of this one, articular cartilage, we can say, or the cushioning of the knee, we can heal it with physiotherapy. We do treatments such as ultrasound, class 4 laser, then IFT, shortwave diathermy. With all this, what happens, whatever wear and tear has happened in the knee joint, that will start getting healed. Okay, then what we do, we strengthen these muscles. We strengthen the thigh muscles, that is quadriceps, and the hamstring muscles. We strengthen them. The position of this bone will start improving, and the gap will be created with regular exercise. We improve the alignment with manual mobilization of the knee. So if there is 1 mm change in the alignment also, the articular surface will be in different position, and the knee pain comes down, and the wear and tear also comes down. We also use shockwave therapy to align this structure. Okay, so we improve this one, and with all this, the lubrication also develops. The synovial fluid also starts getting better. Once the healing starts, there is an improvement in synovial fluid, which will allow the joint to move without friction. That is, if the synovial fluid is there, it acts as a lubricant. So without friction, it will start articulating. And what the patient has to do is decrease the body weight. And again, they have to avoid certain activities like sitting down, climbing the stairs and all. So the condition will start improving.
And for all of you watching, I'm going to link the video up above here where Dr. Harsha has shown the equipment and machines that are used in his clinic. And finally, the sixth question is, why should we avoid painkillers for knee arthritis?
Okay, as mentioned earlier, painkiller should be avoided because it doesn't help in solving the issue. Instead, it will subside only the symptoms at the particular time when the painkiller is taken, but it will not improve the cause. The cause is wear and tear of the knee. So any painkiller will not help improve the wear and tear. It will only subside the pain at that particular time till the effect of the painkiller is there. But constant painkiller will have a bad effect on the kidney and liver. Factors which will help to improve the wear and tear, we should work on that, and that is only done by active physiotherapy.
Right. Not painkillers.
Yes.
Yes. Now, we have a bonus question for all of you who have stayed till this point in the video. And that bonus question is, how can we prevent knee arthritis altogether, doctor?
First of all, if there is a knee pain, you have to get it examined, try to know whether it is, what is causing, is it arthritis or some other thing. As I told earlier, a simple X-ray will rule out your knee arthritis. That is a standing X-ray. Okay. With that, if a patient is weighing more, they have to avoid certain exercise like walking, jogging. We basically call them as weight-bearing exercise. Okay. So they should avoid weight-bearing exercise and do non-weight-bearing exercise instead, like cycling and swimming. That will prevent wear and tear of the knee joint, number one. And number two is, if they are having knee pain, avoid sitting down and stop using the staircase as much as possible. Okay. So, these are the basic things a person needs to do when they have a knee pain. And
I would like to add that they just have to make sure they stay in the optimum weight range, not go overweight, and exercise regularly, strengthen leg muscles.
And better consult a physiotherapist. They will help you to achieve your goals.
It's important to take the advice and guidance of an expert before you start working on your body. So,
because each body type differs, each arthritis differs. As I told, there are different grades in the arthritis, and if you meet an expert, they will tell you what exactly the grade is and what type of treatment and exercise is required for the particular problem.
Yes, always consult an expert, and for that reason, I have displayed Dr. Harsha's contact details on the screen and in the description box below. So thank you, Dr. Harsha, for spending time in the middle of your work day for this. Feel free to check out the description box and take a look at Sanmati Physiotherapy YouTube page as well for more advice and such videos.
I hope the video was informative. Thank you again.
Thank you. So these were the 6 questions that I wanted to ask Dr. Harsha to share his advice with you. If you liked it and found it useful, then please give it a big thumbs up. That would mean a lot to me. And share it with people in your circle like family, friends who might be suffering from knee arthritis. And if you think you need Dr. Harsha's help, then don't forget to check out the link to his YouTube channel, Sanmati Physiotherapy, which is in the description box below. And of course, his contact details are displayed on the screen for you to contact him. That's it for this video. If you think my channel is helpful to you and want to support me, then please hit the subscribe button. I appreciate you spending your time with me. Before I end this video, Happy New Year, wishing you a healthy and successful 2023. Alright, so I'll see you in the next video. Until then, take care. Bye.